Do you feel bloated all the time and you do not want to eat because you feel discomfort in your belly? If so, then this video is for you. Hi, I am Dr. Diwakar Manandhar, a licensed medical doctor in Nepal, and today one of our friends from TikTok has asked us a question regarding complications of gas. So in this video, I'll be talking about what gastritis is, what are its causes, what are its symptoms, and how we can treat the condition. And at the end of this video, we will talk about what are the complications of gastritis which our friend has asked. So before starting this video, I would appreciate it if you would like this video, if you would share this video, and if you would subscribe to this channel. Now let's get into it. Now what is gastritis? It is the inflammation or the irritation of the gastric mucosa, which is the inner lining of the stomach, and it affects most of the people around the globe. For this reason, the patient visits multiple hospitals, takes multiple consultations, and are on a continuous supply of medicine. But still, the condition doesn't improve. Now, gastritis presents differently in different populations. For example, gastritis in some people starts very early and gets remedied very quickly. This type of gastritis is called acute gastritis. But on the other side, some people face this problem for a long duration, for months and even for years, and that is called chronic gastritis. Now, what are the conditions that causes gastritis? There are many etiology, there are many causes for it, and the number one cause is an infection called H. pylori. It is an infection that resides in your stomach, and it produces an enzyme which converts urea into ammonia, which helps protect the bacteria from the acid that is present in our stomach, and it is able to survive in our stomach. And after it gets colonized there, after it multiplies there, it starts to feed on the gastric tissue or the stomach tissue and cause symptoms. Now this bacteria is present in almost half of the population around the world. Now the second cause is medication, which consists mainly of NSAIDs, or we call it non-steroidal anti-inflammatory medications, which includes aspirin, ibuprofen, naproxen, which are mainly painkillers, but aspirin is a medication that is given to the heart patient to thin out the blood so that the vessels do not get clogged with the thrombus. If it does, it can present with symptoms such as heart attack or claudication pain in your leg. The third important cause for gastritis is alcohol, because alcohol irritates the inner lining of your stomach, leading to small ulcerations in your stomach, leading to your symptoms. Smoking also causes gastritis because it can decrease the blood supply to your stomach, reducing the mucous lining over the stomach, causing irritation and ulceration. Another important cause for gastritis is autoimmune, where your immune system attacks the gastric cells, the protective gastric cells, and leads to increased irritation in your stomach, leading to gastritis. And finally, if a person is suffering from increased stress, or if the patient is hospitalized after a long or massive surgery, then the patient also can suffer from gastritis. So after going through all the etiology or causes for gastritis, how can the patient present to us? So the patient can present with pain in the upper abdomen. Sometimes the pain can be confused with myocardial infarction or heart attack, because when the inferior wall of the heart gets affected, then it can produce similar symptoms to gastritis, and it is aggravated when the patient is walking or climbing upstairs. Second, the patient feels very bloated and he feels his stomach is very full even after small meals, and he will have decreased appetite. The patient may be nauseous all the time, and sometimes in extreme cases the patient might also vomit. Sometimes the vomit may contain blood, and the stool may also be black tarry in color, and in the end the patient might feel tired all the time, more than usual. Now what are the tests that we can do? Number one, we can go for an endoscopy, where a camera is sent from the mouth to the stomach, where the camera sees everything, where the lesions are, if there's any ulcerations, if there is any bleeding, and from there we can take a small tissue and test for H. pylori infections. Number two, we can go for a complete blood count to see whether if there is any signs of infection. Number 3, if endoscopy is not possible, then we can go for a urease breath test, which also indicates if there is presence of an H. pylori infection. Now, talking about the complication that the patient might present with who have gastritis, number 1, the patient might have severe abdominal pain. Number 2, the patient might have gastrointestinal hemorrhage, which can cause increased amount of blood in the vomit, and the stool can be very dark and very gooey, very smelly. If the patient is suffering from gastritis for a long period, then the patient might be suffering from gastric carcinoma or cancer in the stomach. And as the patient is suffering from pain abdomen, the patient doesn't feel like eating food, which can cause malnutrition in that patient. Sometimes the gastritis can cause ulceration in the stomach lining, which can cause peritonitis, severe pain in the abdomen. Now, what are the home remedies that we can do to prevent this condition? Number 1, eat healthy. Do not eat junk foods. Number 2, do not drink alcohol. Quit smoking. And if you're taking any painkillers, especially NSAIDs, you can consult your doctor to change those medications. Now, if you have been diagnosed as having an H. pylori infection, then your doctor would prescribe you with 2 antibiotics and 1 proton pump inhibitor for about 2 weeks. And after that, you would be advised to frequently follow up to see whether that infection has been cured. But if you are not suffering from that H. pylori infection, then we can prescribe some medications such as antacids, H2 blockers, which consists of ranitidine, proton pump inhibitors, which consist of omeprazole, pantoprazole, rabeprazole, or a surface protector such as sucralfate. Now, when should you consult your doctor? You should consult your doctor if you have increased amount of vomit, if you have vomiting blood, if you are having severe pain in your abdomen, then definitely you should go to the ER and seek for emergency medical attention. So I hope this video has been helpful to you. If you have any questions, you can write in the comment section. I would appreciate it if you would like this video, if you would share this video, and if you would subscribe to this channel. So thank you for watching this video. Until next time, see you.